hmm
Hi, welcome. I am so
Hello,
glad that you
hello,
reached out and scheduled this appointment. Welcome.
hello.
Before we get started today, I want to take some time to go over informed consent with you. It might feel a bit formal, but it's really important that you understand what therapy with me will look like, what your rights are, and what you can expect. Does that sound okay?
Yes, that sounds good.
Okay, great. So, first, I want to tell you a little bit about myself and my qualifications. I'm currently a student therapist working towards my license as a marriage and family therapist. That means I'm still in my training program and I work under the supervision of a licensed clinician. So, my supervisor's name is Dr. Sarah Mitchell. And
hmm
she is a licensed marriage and family therapist with over 15 years of experience. I meet with her weekly to discuss my cases, which means I will be talking with her about our work together. She is just here to help me make sure I'm providing you with the best care possible and kind of guiding me through, the whole process as I am still studying. Are there any
Okay.
questions you have about that?
No, that makes sense to me.
Good. Okay, now in terms of my scope of practice, I work with individuals, couples, families on issues like relationship difficulties, anxiety, depression, life transitions, and family conflict. My approach is collaborative, meaning we will work together to identify your goals and figure out what strategies might be most helpful for you. Now,
Mhm.
I use a systemic lens, which means I think about how relationships and context shape our experiences. If you come to me with concerns that are outside of my scope of practice or my training, I will let you know, and I will help you find a referral to somebody who specializes in that area. Does
Okay.
that make sense so far?
hmm
Awesome. Okay, great. Now, let's talk about confidentiality because this is one of the most important things. Everything you share with me here in our sessions is confidential, which means I will not share it with anyone without your written permission. Okay. However, there are some legal limits to confidentiality that I need to tell you about. I am required by law to break confidentiality if I believe you are at risk of harming yourself or somebody else, if I suspect abuse or neglect of a child, elderly person, or dependent adult, or if I receive a court order requiring me to release your records. In those situations, I would need to report to the appropriate authorities or take actions to keep you or others safe. Do you have any questions about that?
So if I told you I was thinking about suicide, you would have to report that?
Okay, that is an excellent question. If you are having thoughts about suicide, I want you to feel safe telling me about it so that we can work through it together.
hmm
I would only need to break confidentiality if I believed you are in imminent danger, which means you have a specific plan and you've shared with me that you intend to act on it very soon. My goal is always, point blank period, to keep you
hmm
safe while also respecting your privacy. And so at that point, we would talk through what steps we can take together to keep you safe. Does that help
Okay.
clarify?
Yes, thank you.
Okay, awesome. So now we're going to talk about the risks and benefits of therapy. The
Okay.
benefits of therapy can include feeling less stressed, improving your relationships, developing better coping skills, and gaining insight into patterns or habits that just might not be working for you. However, it can also be pretty uncomfortable at times. We're going to be talking about a lot of difficult things, and this will bring up a lot of painful emotions. It's pretty common that sometimes people will feel worse before they feel better as we're working through these things. And also, there is no guarantee that therapy can solve all your problems, but my commitment is to work with you as effectively as I can. Does that make sense?
Yep.
Perfect. All right, so now we are going to talk about fees and scheduling. Just as a, introduction to me, my fee is $80 per session, and each session will be 50 minutes long. Payment
Okay.
is due at the end of each session, and I accept cash, check, credit card. If you need to cancel or reschedule, please give me at least a 24-hour notice. Because if you cancel within less than 24 hours or just don't show up for the session at all, you will be charged the full session fee. And the only reason for that is it's really hard to schedule somebody last minute if you cancel. It's just hard for me to fill your spot.
Hmm.
So, are there any questions on fees or scheduling?
Nope, that's clear as day.
Awesome. Okay, last thing I want to mention is that our relationship will be strictly professional. That means we will only meet in this office during our scheduled appointments, and any contact outside of our sessions needs to be limited to scheduling or check ins if necessary. I will not be able to meet you socially or develop a friendship with you outside of therapy
Mhm.
because that could interfere with the work
Yeah.
that we're doing together, right? It makes
Yeah.
sense.
Yeah.
This boundary is in place to protect you and to make sure our work stays focused on your needs. That makes sense, right?
Yep. Of course.
Awesome. Wonderful. Okay, do you have any other questions before we get started?
I'm ready. I think I'm good.
Okay, great. I have a consent form here that summarizes literally everything we just talked about. And
Okay.
I would like you to take a moment to read through it, and then if you feel comfortable moving forward, then you can sign it and we'll get started. Remember,
Sweet.
you can ask me to stop or take a break at any time during our sessions. This is your time, and I want you to
Hmm.
feel safe and supported. Does that sound good?
Yes, of course. Thank you.
Yes, you're very welcome. So let's go ahead and get started.